Hello, and good evening once again. Dr. Alalade here, and we're about to start this program today, the effective determination of ovulation seminar. I'm sure you're watching me wherever you are, at home, at work, probably in transit, and I'll be discussing from here live. First of all, I want to make sure that you're all settled into the group and that my audio is very good. If you can hear me clearly, let me know. If you can't hear me at all, let me know so that I can adjust or edit or improve things here. So let me know my audio level where you are. Let me know if my broadcast is loud enough, and if you have any concerns as I talk here. Okay, so first of all, let me know if you can hear me. We have over 300 people registered. This is one of our biggest seminars in a long time, and I'm sure we are all set and waiting for action. The reason why you're here, thank you so much, Basirat. The reason why you're here today is to enhance what you know, what you've known before, and if possible, to even get answers to some questions that you might have. So once again, I want to say I'm Dr. Alalade, and I'm happy for you to be here. I'm happy to be here, and I'm hoping we're going to have a wonderful time. I have Dr. Esther in the background, and if at any time I run out of saliva, she'll probably be on hand to assist and to answer questions as well. We have our moderators also in the background waiting to answer questions. Now, the way we do seminars here, okay, I've opened the seminar. Shortly, I'm going to say a word of prayer. If you have any friends that are also registered for the seminar, that are supposed to be here, that they've paid for the seminar, go and tell them that we have started already. Okay, I don't want anybody to miss any part of the seminar. I don't want to have to repeat the things that we've said at the beginning of the seminar or towards the end. So if you're supposed to be here, you know somebody that is supposed to be here, go get them and drag them here, that we need them. We don't want to miss them. So welcome once again this afternoon or this evening. My name is Dr. J, and I'm Dr. Babajide Alalade, one of the admins here at AsktheGynaecologist, and I have the pleasure of hosting you tonight for the ovulation seminar. And I'm so delighted, and I know that you're happy as well. So I'm going to say a word of prayer. Somebody said they can't hear me, but most people can hear me, so it's probably your phone or your network. So try and check your settings there. Close any unused apps on your phone. Ensure that you're in a location at home that you have good reception, and lastly, close any make sure you have enough data on your phone so that you don't have issues at all. Thank you, Lily, for that advice. I really appreciate it. So let us pray together. I believe in God, and I don't really worry about what maybe religion affiliation you have. My belief is that I believe in God, and that there's somebody that is above us. It might not be a human being. I don't know what that thing is or what that person is, but I know that there's somebody above us, in charge of the things we do, or controlling this whole affair in this whole round, beautiful ball called health. Okay, so let us pray. Almighty God, we thank you for this day and opportunity to be here again to share out of the things we know, to know more about our body despite the limitations we have. We glorify your name, we bless you, and we pray that the things we say here shall not fall and have no value or effect. It shall produce after its kind even greater things. We pray, we ask that any question people have, we'll be able to address, and also ensure people partake and they benefit immensely from this seminar tonight. By your grace, in your name, we ask. Amen. So if you believe, say amen. And if you don't believe, that's okay. But I try to pray without using any name of any particular God, because I believe that there's one God. We might have different approaches to this God, but the most important thing that we've prayed and we've put God ahead of us, that He sees the beginning and the end even before we start. Once again, welcome to this seminar. I'm Alalade. The topic of today is about ovulation, and I've allowed people to post questions online on this group prior to now, so that people that have any questions, they've been able to basically ask their questions, and we can gather them before we start. I'm just checking my audio. I'm in transit, so I didn't really check much things. So ovulation actually is a special process, okay, that happens once during every menstrual cycle, okay, and it corresponds to your and it is every month in most women. For some women, they will not have regular ovulation. We'll talk about that later. as we proceed in this seminar. If you have any questions, all the questions, so that I can talk the seminar, then I'll open the floor for questions. While I'm answering questions now, after my presentation, I will go through the old questions that people have submitted on this seminar page as I'm answering other questions. Okay, so ovulation is a one-time event. Okay, and it's that time when your egg is released from your ovary for you to get pregnant. Okay, naturally, without ovulation you can't get pregnant. Okay, so naturally, for you to get pregnant naturally, I'm not talking about IVF yet, without ovulation you can't get pregnant. Okay, so ovulation is the beginning of the journey for us to be around here, for us to come to life. That ovulation is the beginning. And if you look at the surface of the ovary, there are small points like boils, like blisters. Okay, they contain egg. We call them follicles. Okay, at every time in during the month, one of these follicles, one of these tiny blisters. Okay, look at your tablet, your paracetamol. It comes in blister pack, you know, that you press and you release the tablet. The same thing too, you have something like that all over the ovary or on both ovaries. Okay, so at some point, okay, one of those blisters will become bigger than the rest, and it will pop. If you can show you on my diagram here, so it will pop. Let us come here. I'll zoom here. So you can see that ovary here. Okay, that's ovary here. You can see all those tiny blisters. So one of them will become big, pop, and release the egg here. And as the egg journeys, it enters into the tube. So you can see that egg being released here, and it moves into the tube on its journey. So naturally, that journey to get pregnant, okay, starts from ovulation. So that's what I'm trying to say. Okay, so you need that follicle on the ovary to release that egg. All right, so generally we know, and I've been saying this all the time, that ovulation happens around 12 to 16 days before your next period. And I'll show you the reasons why I'm using that generalization, that the ovulation happens around 12 to 16 days before your next period. Okay, now during this special process, one of the mature eggs that I've explained to you would pop, release the egg. Okay, while that is happening on your ovary, the womb is also getting ready. See this womb layer? Let me see if I can zoom in here. So this womb layer, that is, you say, this womb layer, okay, is also getting ready and getting thick. So if I zoom down into this womb layer here, this is what I see. So the womb is getting ready and getting thick. Okay, so at this line here, that is when your eggs is released. That's ovulation. So if let me try and zoom in again, and you see this line here, that line corresponds to the day of your ovulation. And if you follow it here, you see 14 there. That's just an example, okay, of a 28-day cycle. So if I come again here, I'm going to zoom here. Okay, good. So you can see this line here corresponds to when your womb is very thick to receive the egg, starting the journey from the ovary here. That day corresponds to your mid-cycle, and it's your ovulation. That's exactly what I'm trying to say here. And we know from looking at this chart again that there's a particular hormone we call LH. If you see that hormone LH is the one that peaks highest amongst all the other hormones, including FSH, estrogen, progesterone. LH is the one that peaks. It goes high up. And that's the same hormone that we check in your ovulation kit to know whether you are in your fertile window. Okay, so let's continue this discussion. We'll come back to that again. Good. So 10 important things you should know about ovulation. Number 1, once the egg is released from the ovary, okay, the egg survives around 12 to 24 hours before getting fertilized. Or if it doesn't get fertilized after 12 to 24 hours, the egg starts to depreciate and die. The egg has a shortened lifespan compared to sperm that can live for up to 5 days. In some very notorious sperm, they can live for up to 7 days. So we know that the sperm can live for up to 5 days average. Some will live 3 days, but most will live 5 days, okay? And the egg release can last only 12 to 24 hours. So you have a short window where you can get pregnant. But the good thing is that the sperm can live long, because boys, the girl will pass with the road once, but the boys will hang on the road waiting for the girl to pass. It's the same ideology. Now, the egg, we know, have it in your back of your mind that the egg can last 12 to 24 hours. Normally, ideally, in the ideal situation, only one egg is released. But in some rare situations, 2 eggs can be released. Okay, and if 2 eggs are released, 2 sperm need to do the job. So that's why you see you have twins that are boy and girl, or boy, but they are entirely different. So, but it can happen. We call those fraternal twins. So ideally, in most cases, 1 egg is released. We call that egg is released from the dominant follicle. The dominant follicle, the dominant big blister on your ovary. Usually, the body works in a way that only 1 dominant follicle is released, okay? And that is where the egg pops out from, goes into your tube to get you ready. Amazingly, once you're born as a woman, you have about 2 million plus or so immature eggs deposited within you. As you get older, as you start to have period, the eggs start to depreciate in quality and quantity. That is standard. Nobody can increase the number of eggs you're going to have, no matter what they do. But because once you're born, the amount of eggs you carry in that your truck is already been put into you by God. As you get older, it starts to drop in quantity and quality. Much more so, once you cross that line of 40 years old, the quality of the egg starts to fall drastically, and the quality. And in fact, some eggs have difficulty in having their DNA divided, so they can miscarry. But the good thing about it too is that because they have problem with their division too, they can divide in a very fast way and also make you have twins as you cross 40. But I'm not saying that you can't get pregnant after 40. I'm only saying the chances of successful pregnancy, no miscarriage, normal delivery, no complication, is much higher and lesser than somebody that is less than that age. I've seen people 30 years old that have a very bad antenatal history. I've seen people that are more than 40 and they have good antenatal history. But your odds, your chances of success, your chances of better success if you get pregnant after 40 is less. Your chances of antenatal complications, diabetes, blood pressure, and so on and so forth, if you get pregnant above 40 is higher. That is what I'm trying to say and preach here. And as we age, our body obviously changes, our mind gets better, our body depreciates in quality and all that, and processing. Chances of eggs that are very good and very mature starts to drop. So as I'm saying, usually if you look at this chart I was showing you, you can see that at around the day 14, when your LH goes up and spikes, that you ovulate, some people will have pain around the side of their tummy where the eggs is being released from. Okay, so if your egg is being released from your left ovary or right ovary, you can have some kind of sharp pain. We call that mid-cycle pain, Michel-Smear's pain. Mid-cycle pain is not ectopic, it's not miscarriage, it's not anything big deal. Okay, simple painkillers will do. And some people have this kind of pain regularly during their mid-cycle, and they can have some dull ache pain, sometimes making them feel a little bit warm and tired. And sometimes too around your time of ovulation, some people also have a high temperature spike. We call that increase in your basal temperature. It's very common in mammals. Okay, if you look at if you studied Greek while you are in high school, you see that we talk about animals. They are in their eat, the hysteros cycle, the eat period, where the temperature goes up and they are running up and down to get a male, so a counterpart to mate on them. The same thing to some women too. They are very horny and they are very hypersexual around the time of their ovulation, and they can pounce on anybody they see around. We know that it's true. So this is the same thing that happens in humans too, or similar, around the time of your ovulation. So around your ovulation, the egg is being released, you have some dull ache pain, your body is so warm, your husband touches around your vagina area is so hot, like see they put a generator engine there. Is because you're ovulating. It's nothing to worry about. In fact, when you ovulate and release egg from that part of your ovary, some people, they release some fluid too, and that fluid can gather in what we call the pouch of Douglas behind their womb. And if we scan people around the ovulation time, we see fluid gather there. Okay, now what you must know, 10 things you must know is that ovulation vary from woman to woman. The time you're ovulating this month is different from the time your friend will be ovulating in school. It's going to vary. It's never going to be the same. And it's possible that some women will not even feel or have any symptoms of ovulation at all, but they still ovulate. I've seen people come to me, doctor, I've not seen my egg whites. Am I ovulating? Am I having ovulation? Yes, you can still ovulate. You can still ovulate even despite not seeing your egg white, not having that high temperature in your body that we say. You can still ovulate. In most cases, if you're having a regular period and your period is occurring at least every 28 days or 30 days and it's very, very regular, your chances of ovulating is more than 90%. Okay, in most cases. Okay, so if you're having a regular cycle, your chances of ovulating is much, much higher than expected or than you think. Some women, okay, ovulate like clockwork. Bang, 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 bang. They put their date of period on the app, and they can actually predict when their period will start, almost to minus or plus one. In fact, they can be very accurate. For short ladies, I know it's not everyone listening to me here that has a regular period. Some people listening to me here don't have regular period. For short people that have a regular period, the chances of ovulating is very high in them. And I always tell people to know whether you're ovulating. If you don't see your egg white and you have a regular period, to know exactly, go and do your day 21 progesterone, and it should be exactly day 21. However, if that day falls on a weekend or Sunday and your lab is not open, the next available date, go and do it. Okay, what we are looking for is your progesterone. Usually, ideally, I want your progesterone to be more than 20, but sometimes it can be 10 or 7, you're still ovulating. But if it's more than 20, it's more or less convincing that you're ovulating. So if your progesterone is more than 20 around your day 21 progesterone test that sample, the chances of ovulating is almost 99%. Okay, now I always tell people too about cervical mucus, the egg white. You know, when you break the egg and you know that white part of the egg before it congeals on when you boil the egg, it's like very, very slimy, very, very soft, very slippery. That medium is essential for sperm transport. That is why the egg white, seeing it is very good. It shows that your vagina is ready to transport sperm that may be deposited, and the vaginal fluid or vaginal environment is not hostile to sperm transport. And in fact, if you're not producing egg white and you're trying to get pregnant, I always tell my people on my sign up page, premium services and ATG here, that they should use pre-seed lubricant. The pre-seed lubricant, PRESEED, has that preparation that is not hostile to sperm and makes this sex very easy to do. It's so soft, so soft. It's not Vaseline. It's so soft. It makes the vagina very, very moist and warm. Makes sex quicker and allows and makes the vagina very comfortable for sperm to travel. Okay. Sometimes, like I said again, you might have some slight spotting around the ovulation, and usually around the ovulation, if you notice yourself, for some women, they have that heightened sense of sex. Like I said again, hyper arousal. They want to have sex. They want to jump on any guy around. It's natural sometimes, but you have to control yourself. That's why we are humans. And some women too will have heightened sense of smell, so they can easily smell that mama in the kitchen. Anything passing around, they smell. They have that heightened sensation of smell, and sometimes even vision and even perception, because at that point their body is working to get the best. Okay, it's just natural instinct. So if you're having this kind of heightened sensation, heightened sex drive, some kind of bloating in your tummy, okay, around the ovulation, is nothing wrong with you. Now, the most important part of this lecture obviously is now how to track your ovulation. So pay attention to me. Now, how to track your ovulation. If you look at this, my chart here. Now, I'm going to take off my face, so I will show the chart. I'm going to zoom in into the chart. I'm going to zoom into the chart. Good. Now look at my pen. Look at this place here. That is day 1. There's no fertilization. There's no egg coming. The menstruation starts. Follow it up here, day 1. And you go all to the end, day 28. The first day you see blood, okay, is day 1. Okay. So this day 1 to 28, we must divide it into 2. But when I say 2, I don't mean 2 equal parts. It's never going to be 2 equal parts. Divided into 2 does not mean 2 equal parts. Because they say you should share the food with your junior sister, doesn't mean you will give her the same equal part. As a big sister in the house, you take the biggest share. It's common in African society. Apologies. So 2 parts does not mean 2 equal parts. Don't forget that. So we're going to divide this cycle into 2 parts. It's a 28-day cycle. And these 2 parts, I gave that instruction that the second part of these 2 parts must be 14. What it means is that if you have a 28-day cycle, you're going to put 14 behind here and the other 14 in front here. If you have a 30-day cycle, you put 14 behind here, you put 16 ahead here. If you have a 31-day cycle that is regular, you put 14, always constant, behind here and 17 in front here. If you have a 27-day cycle, you put 14 behind here and 13 ahead here. Are you following me? Am I making sense? So again, the 14 must be constant behind. The one at front will always fluctuate. We need that 14. We call it the luteal phase. That luteal phase is very important for that 14. It allows maturation. I don't know why nature chose that 14, but nature has decided in its own infinite understanding and mercy that 14 must be constant. If it's short, it causes what we call luteal phase deficiency, and it affects the maturation and the growth and everything of you getting pregnant. If you have a shortened luteal phase, it affects progesterone, everything about your egg getting well and perfectly to be functioning well. So the luteal phase, which is the second part, must be constant. The beginning part is always changing, and that is the follicular phase. We leave that aside. So, how do you now calculate your ovulation day? I'll show you that. I'll talk about test kits now so that you get it clearly. Now, these test kits that I said before, they check this hormone. See this hormone here, LH. See where my pen is. If you see this hormone here I'm pointing to, you see this red peak here. That means that on your ovulation day or around the ovulation, the hormone that peaks and is highest in your body, I mean your reproductive hormones, amongst the other hormones, LH is one that is highest. LH, luteinizing hormone. That hormone will go up. And if we're trying to trigger ovulation in you, if you're going for IVF, we give injections to accelerate or to ginger or to cause that surge of LH that will make the egg that we've been trying to mature with other injections to pop and release eggs. So we've been giving injection all the while to mature this egg, and once we think we've reached that level by scanning you, monitoring the follicle, and we think it's ready to release egg, we give that injection it's a particular injection to make that egg, to release the follicle, to get you pregnant, to make it to release the egg. Okay? So that's the purpose of the injection, to activate that LH surge. This same hormone, LH, is what we are looking for in all your tests. Your clear blue test, your all these blue tests. I'll talk about that later. That hormone is what we're trying to pick as well. I'll talk about that later, like I said. So, let us take some typical examples. I'm going to use cycles from 22 to 32 to show you your date of ovulation. And please follow me. This is the most important part of this lecture. This is the most important part of this lecture. So again, if you have a 22-day cycle and the 14, like I said again, is constant, that is to say, you're going to have 8 days in front here. Am I correct? Yes, 8 days. Yep. Keep following me. If you have a 23-day cycle, you're going to have 14 here, and you're going to have 9 days here. A 24-day cycle, you have 14 here and 10 days here. 25-day cycle, you have 14 days here and 11. I'll move to 28 now. 28-day cycle, 14 and 14. 29-day cycle, 14 and 15. 30-day cycle, 14 and 16. 31-day cycle, 14, 17. 32-day, 14, 18. Now, so remember I said 18. Day 1 to 18, ovulate, the remaining 14. That means that for you to know your day of ovulation, okay, you'll be ovulating on what that day ends on your first part of the cycle. So let's take 22-day cycle, for example. That means we have 8 days here. That means that person on the 22-day cycle will be ovulating on day 8. The 23-day cycle, day 9. 24-day cycle, day 10. 25-day cycle, day 11, and so on and so forth. 28-day cycle, day 14. 30-day cycle, day 16. Now, the next question that people get it wrong, that when you tell them and they know that day 16, day this, day that is ovulation, they think it means that day 16th of the month or 16th of any particular month. No, it's not 16th of any particular month. That's another stumbling block for most people. The fact that this month, the fact that you're ovulating on 16th day of your cycle does not mean you'll be ovulating on day 16 of every month. No. Your day 16 might fall on different day for different months, depending on that particular month, depending on your cycle. So if you know it's day 16 that you're going to ovulate, your day 16 will be counting from the first day you see your period, okay, to that 16th day. And that 16th day can fall at any point in your cycle, in the month. So for somebody that their first period started on day 10 or on 10th of June, and this person that started period on the first day of period is 10th of June, she has a 16-day ovulation. She'll be ovulating on 26th of June. Can you see it's different? If this same person that has the 16th ovulation started a period on, let's say, June 12, she's going to be ovulating around June 28. You see what I'm saying? So if somebody that has a 30-day cycle, 14-16, that is ovulating on day 16, has a first period on 2nd of January, that means that our ovulation is going to be on January 18. Can you see? So it always differs. It always differs depending on your cycle, depending on the month, and it always changes with different months. Because you see your day 16 or day 18 on August particular day does not mean you're going to sit again on that particular day the next month. Okay, so I hope it's making sense now. All right, I'll use other practical examples later as I progress in this discussion. I hope I'm carrying everybody along. So take a minute to digest these things as I've said them. Take a minute to let it sink down within you, okay? And I'll continue. Some people think exercise affects ovulation, prolactin, food they eat, blah, blah, blah. Yes, exercise can affect ovulation. If you exercise more than 60 minutes in a day, it will burn you out because it will make you have a regular cycle. If you exercise less than 60 minutes a day, okay, your chance of ovulating is good. Exercising more than 60 minutes per day can be damaging and can make your period irregular. Everything in life is balanced. Overdoing anything can cause issue. So if you're on exercise, keep exercise around 30 to 45 minutes per day. That's enough. Or if you want to, maybe to give you a standard figure, make it only 30 minutes a day. Okay? After the seminar, I'll give you the PDF and I will download the video and put the video link in the PDF so you can watch the video over again and over again and over again and over again. Now, exercise plays a key role in ovulation. If you're obese, it will make your ovulation irregular. If you're very, very thin, it makes your ovulation irregular. So overeating, undereating can affect. So you need balance. That's why I advocate for regular workout, but not overworking out. Okay, because regular workout, sustainable regular workout creates an habitual function in your body that makes your cycle very, very regular. Somebody's angry here. I'm trying to carry everybody along to ensure you understand what I'm saying. So putting an angry face suggests that you're probably lagging behind. Probably it's your network. Probably it's not me. Probably it's me. If it's me, I'll try and go over it again. And if it's your network, don't panic now. You can watch the video again and try and stay in a particular spot in your house where you can get the best reception. That's why I've chosen this particular spot in this house here where you can get a good reception. So do the same thing too. Now, some studies have shown that women who exercise around 30 minutes per day, okay, they have a reduced risks of infertility problems from ovulation problem. There are so many things that can cause infertility. So many things that can cause infertility. Blocked tubes and so on and so forth. But if you have regular exercise, the chances of having infertility from ovulation problems is almost nada. Almost nada. Okay? Now, some few things, okay? After I've gone through this, I'll start taking questions now, okay? So don't panic, just hold on. Some few things can affect and distort your regular cycle. Number one, if you have a shortened interval between the delivery of one baby and the next baby, shortened interval between delivery of one baby and the next baby, it can affect and distort your regular cycle. After operation to remove fibroid, if you had a fibroid removal, you can make your period is slightly heavier or sometimes even scantier. And the reasons are sometimes when your fibroid has been removed and your womb cavity is healing, there could be scar tissue in your womb and they can obstruct or distort the flow of your period. It's not common, but it can happen. Sometimes after a cesarean section, your period could be slightly delayed, and even in fact, the first one could be slightly heavier than expected. Okay? And you have to pay attention to your body after every delivery, because your period could be slightly heavier, it could change, it could be longer, and your cycle entirely could be totally different. You could be having a 28-day cycle prior to your C-section, and after your C-section, you have a 30-day cycle. So you have to pay attention to your body, because your body could reset after C-section. Like I've seen some women prior to delivery, they don't squirt during sex. After sex, and now after they've had a baby now, during sex, you touch their body, 2 seconds, everything is boss. 2 seconds, everything boss. 2 seconds, they are already squirting and pouring the urine everywhere. So your body might change shortly after delivery. Sometimes too, sadly, after a miscarriage, your body could change and your period could be slightly changed and heavier. After an HSG is slightly uncomfortable. The test we do to check if your tubes are open or closed or damaged or something. After HSG, your period could be slightly changed, could be a little bit heavier. Okay? Sometimes too, after IVF failure, because during IVF we use so many medications to reprogram your cycle, to restart your cycle, to mature eggs. They can cause some disorder after everything. And so after IVF procedure, your cycle could be slightly distorted. So pay attention to your body. So after IVF procedure, your cycle could change or your ovulation could change. Okay, so that's why if people have a failed IVF, I tell them to relax or hold on, allow their body to reset. Give your body 2-3 months before you start trying again and pumping those injections to get action happen. Sometimes too, after a Chlorine treatment failure, after letrozole treatment failure, for also for the womb, for the eggs, for treating ovulation problems. Okay. Breastfeeding too can have an effect on your ovulation. For you to breastfeed, you need some level of prolactin in your body. And if this prolactin are in your body higher than a certain level, what it's telling your brain is that you have to produce milk to nurture a baby. So don't have time to produce another baby again. So your body will not ovulate. So if you have heightened level of prolactin, raised prolactin in your body is telling your body by nature wise that nurture that baby that is already there, give the baby milk. In that time, don't get pregnant. Okay, so focus on raising what you have. Okay, so for some reason, so some people they don't have baby, they don't have a baby to nurture, but their prolactin level is raised up. It's a disorder, it's a problem, it's a medical problem, what we call hyperprolactinemia. So if your prolactin is raised to a certain extent that we don't like, it tells your body don't ovulate. So we need to treat and bring the prolactin normal. The same thing too if you have thyroid problems. Thyroid and prolactin can sometimes interact. Okay, if you have thyroid problem, whether it's too high or too low, it will make your body not to ovulate. That is why if you have thyroid problems, we have to manage them before pregnancy, because if it's not managed properly, it can even affect you getting pregnant and can even be distorting during pregnancy. Okay, so if you have thyroid problems, it can affect your ovulation. So we must manage your thyroid problems before you get pregnant. Otherwise, you're going to have problems with ovulation. In fact, if you're going for IVF treatment, we'll put your medication to ensure your thyroid hormone is reset and is in that balanced range. Important. Okay, excessive exercise too can affect your ovulation. Increased level of testosterone, polycystic ovarian syndrome, which we all know, can affect your ovulation. Lifestyle, stress, you smoking, you taking alcohol, it can affect the quality of your egg, it can affect your ovulation. So if you're around people that smoke, you have to excuse them. You have to let them excuse you. They must know you have a goal. Okay? Diabetes too, certain medications for maybe schizophrenia, if some people have some mental challenges, it can also affect level of prolactin and can make ovulation become imbalanced. Okay, and if you're on contraception and you change your contraceptions every time, it can also affect ovulation as well. In summary, before I start taking questions now, I hope you're getting this division: 28 days, 14 days, and so on and so forth. I'll start taking questions now. Okay, I've had some questions that I've stored from the pre-seminar questions. Okay, so in general, if you're going to exercise, avoid too much exercise. Okay, if you're going to get pregnant again, give your body time from last pregnancy to the new pregnancy. Okay, and also avoid stress if you can. And if you have this problems with your ovulation, we need to go to the drawing board, do tests for you to check your LH, FSH, prolactin, progesterone, thyroid hormone function, okay, and do HSG as well to check your tube function. Okay, so we do this hormone profile test, okay, to know where you are. If you're not happy with where you're doing your test around Lagos or around where you are, your locality, and you want a reliable lab to check your test, you can come to the AsktheGynaecologist Laboratories in Lagos. And the address will be put on the screen by our team and moderators, okay? You go to the lab, your test is done, and it's sent to you results on your email or your WhatsApp within 24 hours without delay. And if you do your hormone profile test there, I've given them instructions that they must do your malaria parasite test and they must do white out test to check for thyroid free of charge. It's a mandate. But if you go there, you do your hormone profile or your hormone profile test, okay, you will get white out test, malaria parasite test free of charge. And it's not as if we've matched the money into your other test. No, it's totally exclusive. It's a free gift of about 4,000 naira free to cover your transport. Okay, so you're gonna get it free. I've not matched the test cost into other tests. No, I totally removed it, and I will pay for myself for you for those tests. I've given them instruction for that. Okay, so now I'm going to open the floor now for questions. While I was doing this question, one of our moderators, wonderful lady, amongst our moderators, she's gathered so many questions for me so that I can discuss them on this program. Before I take those questions, because you are watching me live, I'll start taking questions now, and I'm going to go down to the beginning of the page, and I'll start taking questions now. So, thank you, Dr. Esther is already moderating there. I can see Elizabeth, I can see Gloria, I can see all other moderators too, Jeremy and Buzz and things. When you're menstruating regularly, this is Ifeanyi Anyadike, wonderful. I just love those names. Johan, wonderful name, Johan Ifeanyi. When you're menstruating regularly, but the color and flow is not really good, can it affect your ovulation? What do you mean by color? What do you mean by flow? This is very subjective, okay? If you're having regular menstruation, your menstruation is regular, like you can basically program and basically remember to plus or minus 1 day to have your period. The chances of ovulating is more than 90%. All right, that's for Joanne. Thank you, Lily, for being there. I can see Lily's she's massaging her phone there. When is the best day to have sex? Is it the day before ovulation, the day after, or on the same day? So now this comes to the next part of this seminar, the fertile window. If you look at I'm going to zoom in again to this chart on my screen. Now follow me and pay attention. Open your eyes, open your ears, open your mouth, open your nose, and let's deal with it. Now look at this chart on the screen here. You can see obviously that the LH hormone spikes here. It's usually a day before your ovulation. The LH hormone trigger tells your body to go and release that egg. So it takes a while to work its way through. And usually the following day, the egg will be released. So therefore, I know that the egg can last in your body for 12 hours to 24 hours. Therefore, I tell people to have irregular intercourse for a period of time. Now, how do I choose this period of time? Now, listen to me now. So let's assume on a 28-day cycle, for example, that you ovulate around day 14. I know, you know with me that your sperm from your husband, wonderful guy, can live in your vagina, can live in your uterus, can live and loiter around and waiting for attack, to pounce and to shoot like a sniper for at least 3 to 5 days. Most cases 5 days. In some cases, some sperm are notorious. They can live up to 7 days. Okay, so they can live in the desert waiting to shoot and take their shot without getting hungry, without getting tired for at least, let's say, average of 5 days. That is to say, if you start to have sex, okay, I'm using day 14 as a fertile window here, don't forget. So if you start to have sex every other day from day 10, so sex on day 10, sex on day 12, sex on day 14, on day 16, okay, that means that you're giving that sperm chance to be readily available to meet the egg whenever the egg is released. So that is your fertile window. So for this person, day 14 ovulation, your fertile window will be from around day 10 to around day 16. Because I know that if your egg is released on day 14, by day 16 is gone, by day 16 is died, by day 16 is shriveled, by day 16 is no more active, is no more fertile to get you pregnant. So I know that by day 16 that egg is gone. So for sex to happen, for sex to be done, to meet and target your ovulation, if your husband is always away, traveling, not at home, doing this and that, I know the economics of today, the daily hustle and bustle, some men cannot be at home, but you want to target that day, you want to target that action and make it happen. You have to look out for those days from day 10 to day 16 for this particular example. And for your own, if your example is different, as I've explained to you, use the same idea to predict your fertile window. To predict your fertile. So your ovulation day is within and always within your fertile window. Okay? Your ovulation is like a room in a house. The house has many rooms. So your ovulation day is just a room in the house. In fact, only 33% of people get pregnant on the ovulation day. That means that you have all other days to get pregnant. So from those day 10 to 16, for that example I've given, your fertile window is there. So 30 to 40% of pregnancies happen on your ovulation day. That means that you also have a chance of getting pregnant outside the ovulation day. So don't neglect, don't miss other days. Don't let other days escape you. It's not mandatory to see your egg white to get pregnant. It's not mandatory to see egg white to know you're ovulating. Some people don't have that egg white. Some people know the egg white. Some people don't even know what to look for. So just seeing egg white mandatorily does not mean you're going to ovulate. Does not mean you've ovulated. Does not mean you're going to ovulate at all. Okay? But if you see the egg white, it's a good sign. There are other things too. Okay? For you to know your stew is done, you don't only taste the stew, you check the consistency of the meat. You check the aroma. You check other things to know that your stew is done. Okay? There are many factors. Yes. Now, what are the side effects of Chlomid injection? So, I always say you don't take Chlomid without advice from doctor. Ensure if you're taking Chlomid, you're having follicular tracking. Because I've seen people react very, very bad to Chlomid. If you've seen bad people reaction to Chlomid, and it's very common. If you see people react to Chlomid in a bad way, you will not want to take it anyhow. Okay? So, side effect of Chlomid, hot flushes. You feel as if you're hot and your body is boiling inside. Hot flushes. Mood swings. Your mood is changing. Mood swings. Breast discomfort and tenderness. Sometimes you feel like vomiting. Sometimes you feel bloated, as if there's so much hair in your tummy. You're walking up and down, it's like your tummy is shaking, bang, 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 as if they're bouncing hair in your tummy. Some people have headaches as well. These are the few symptoms of, or I'll say side effects of Chlomid. Okay? Irregular menstruation means that your period is totally irregular. Today is 28 days, 32 days, 40 something days cycle. It's very common if you're getting to the end of your reproductive life. People that are around 45 to 50, mostly, they start to have a regular period until their period totally stops. Now, I'll talk about ovulation kit now. Ovulation kit, I'll use the clear blue as example. Remember, I told you that this hormone called LH spikes a day of, or at least some 12 hours before you ovulate. So if you're going to use your clear blue kit to track your ovulation, That kit is designed to give you two lines. It's very similar to what we do for test of pregnancy, but pregnancy test, we're checking for beta HCG hormone. This one, we're checking for the LH hormone. Two different hormones, but the test works in a similar way. So what you're looking for is that this LH hormone is produced into your blood. It will be moved into your kidney. You pee it out. You drop a small pee on that test kit. You give it and read it within 5 minutes. If you read the test kit after 5 minutes, chances of false negative or false positive is very high. So you must read the result within 5 minutes. Very, very important. Very, very important. You must read the result within 5 minutes. So what you're looking for on the clear blue is 2 lines. And this clear blue to track your LH hormone is almost as 98 to 99% accurate. Okay? So what do you do with your clear blue? You drop the urine sample into that small window or small pouch in the clear blue. You wait for within 5 minutes and you see 2 lines. If you see 2 lines, 2 clear blue lines, it means you're positive. You always see 1 line. We call that line the control line. And there's another line called the test line. C for control, T for test. Okay? And some are even digital now. They're a bit expensive, but they do the same thing. So you put that your urine sample on the clear blue. You see 1 line, the control line. Okay? And then you're waiting for the test line. If the test line is thick blue, that making 2 lines now, that means that you are ovulating around that time. Okay? Now, if it's faint line on the test line, you're still ovulating. Chances of success is less. If you're using one that has a digital one, it will give you a chance of ovulation in percentage. But remember, I said again that chances of pregnancy is only 30 to 40% during your ovulation day. That is to say, you still got chance of getting pregnant even outside your ovulation. So that I say, have regular sex in your fertile window. Your ovulation day is just a room in that house. There are other rooms. If you're looking for something, you don't check only one room. You check other rooms too. Just in case, by chance, that key you're looking for is hiding in another room. Somebody took it there. Okay? Thank you. Now let us take another question here. Can someone with ovarian cysts conceive? Yes. Somebody with what we call physiological cyst. Physiological cyst, okay, is a normal cyst. A cyst containing fluid. Okay, it's a cyst. Now somebody is complaining that they can't hear anything. If you can't hear anything, honestly speaking, it's not me. I'm sure can everybody hear my mic here? Sometimes it's your network, it's not me. See, we cannot predict what happens with your network where you are. Okay, sometimes, like I said again, I've been shouting for the last 1 week that ensure you're in a position in your house where you have good reception. Okay, so I'm in one seat. I cannot predict what Equinet and Airtel, GlobalNet, Globalcom will do, okay, to you. So that's why I said that you can come and watch this video over again, because we always have complaint with people having network issues. There's no way I can liaise with network to ensure that you have perfect network during that day. If as happened to me before a year ago, while I was talking, my network got messed up. My Wi-Fi had to messed up, so I was also perplexed too. I understand. I know your frustration, but there's nothing I can physically do from here. So watch the video over again, and you can also get the PDF, okay? And I'll tell you how to get the PDF before I finish this lecture. So with ovarian cyst, so I was talking about a physiological cyst. Physiological cyst is a normal cyst. So when you ovulate and you release the egg from this over here, see that egg goes out here, and that defect, that point where the egg is released, can be covered with fluid, and sometimes it becomes a tiny blister again that contains no egg but just fluid. We call that physiological cyst. They are normal. Most times they will regress. They will disappear. They will regress. They will disappear within 2 to 3 months. Okay, they will disappear. So if a physiological cyst does not stop you from getting pregnant. If you're age 50, you can still get pregnant naturally. I've seen people that are 48, 50 get pregnant naturally. Yes, you can, but your chances are very, very slim compared to somebody that is 30 or 31, 29. I've seen 29-year-old too, they cannot get pregnant too. So it's not age entirely, but age as a factor in your chances of getting pregnant. Okay, now let's take another question. Doctor, you need the PDF. Now, to get a PDF of this seminar, okay, and that PDF, there will be a link to the video of this my seminar. To get a PDF, you just go back to your email that I sent to you to acknowledge your payment. In that email reply I sent to you when you sent your payment evidence, and I sent you the link to join this seminar, just go back to that email and click reply. Once you click reply, okay, just tell me I need PDF. That's all. I'll reply you before the end of next week Saturday with a link to your PDF to download to your phone and keep forever. In that PDF, there will be a link for you to click and watch the video. Now, once you've done that, don't come back on Monday and start pestering me and accuse me that I haven't given you a PDF. I said again, I will give it to you by next week Saturday. I promise. By God's grace, I will fulfill. By the grace of God. Now, in that PDF, you see all the things I've said today and a link to download the video of this seminar and watch at your own comfort. Another thing I will do is that, which you must listen now, is that if you don't click and send a reply from the email I sent to you, I will ask, and you send me a fresh email asking for PDF, I won't reply you. That's why I'm saying this again with all humility. I'm begging you. Don't send a fresh email. If you send a fresh email, I'll probably ignore your email and think that you didn't pay. Or I will ask you for your payment evidence. So if I do ask you for that, don't get upset. To get the email, please, and to get the PDF, please, that welcome email I gave to you, that I sent to you, that I gave to you, that I sent to you, just click reply. Because by clicking reply, that means that I've had interaction with you before. I know you've paid. Then I'll send the link to you without any headache. But if you don't follow my instructions, I'll probably not reply you or ignore you or ask you for payment evidence again. So please follow instruction. If you don't, see, I'm the one handling that email. If you don't follow it, I'll ignore you. Because there's so many things I have to do to make people happy, like yourself. I don't want you to be an hindrance to other people getting their joy. So follow the instructions or I just ignore. Please, I beg you. Okay, now if you've been doing the Clear Blue test kit and you've not been saying 2 lines, that means that you're not ovulating, okay? Or likely not to be ovulating. In that case, we need to know why is that case. Why is that case like that? We need to do your full hormone profile. Your LH, FSH, day 21 progesterone, if possible, your prolactin, testosterone. They get it done in the ATG lab, okay? You do it in my lab, in our ATG lab. We know the result. We're using the state-of-the-art newest machines, which has cost us money to ensure that we get proper result. A lot of mushroom labs out there, you just walk into that lab, they give you any result, they cook any result up for you. We don't do that here. I want to ensure that women are well looked after. That is my purpose here, to ensure that you get the best test. So I've invested so much money to all this equipment to ensure that once you get your test done in that laboratory in Lagos as a gynecology lab, you get enhanced, pure, unconfusing result, and you know what your body is. So we need to do your blood test again to know why you're not ovulating, do all your hormone package, and then we can know what is wrong. But I've seen some people what we call luteinizing or ruptured follicle syndrome. They are not, your follicle is not rupturing despite the LH surge and all that. It's very, very rare. It's about 11% of women or less. Some say 3%. That is very luteinized or ruptured follicle syndrome. In such cases, there are ways we deal with them. Okay. Now, what's the meaning of PCOS? PCOS means polycystic ovarian syndrome, and is the #1 cause of infertility in women today in the world. So, do follicular cysts and hormonal imbalance cause not getting pregnant? Hormonal imbalance can cause not getting pregnant because hormonal imbalance will not make you ovulate. Okay. Somebody's asking that they have raised prolactin and they've used Pluming 2 cycles back, yet no pregnancy. If you have raised prolactin that is not treated, it will make you not to ovulate. And if you don't ovulate, you don't get pregnant at all. Somebody has fibroids and stage 4 endometriosis. She's lost the right tube, probably due to the endometriosis, and she has long periods. Can she get pregnant? She can. As far as one tube is perfectly working well, okay, as far as you're ovulating, we've checked your hormone profile, okay, you are likely going to get pregnant. If you've lost one tube, it drops your chance of pregnancy from 100% to 67%, not 50%. As far as other factors are remaining constant. That is to say, you ovulate and your ovulating husband sperm count is good. You can still get pregnant, only to about 67%. But we need to check all your other hormonal profile though. ATG does not have a lab in the Port Harcourt yet. I can refer you to a specialist friend in the Port Harcourt that can help you your situation to see that you get pregnant, okay? But ATG does not have a lab in Port Harcourt. Somebody asked, she has a retroverted uterus. That is to say, the womb is tilted back. So you see this womb is facing front here. But for some people, their womb is facing back. It does not cause infertility. It might make them have discomfort during sex, but it won't cause infertility in any way. It can make them have discomfort during sex, but it won't cause infertility in any way. Okay? Signs of hormonal imbalance. Okay? Obviously, inability to get pregnant, sometimes feeling hot, sometimes having mood swings, having nausea and vomiting, but sometimes there's no symptom at all. I've already shown you how to calculate your ovulation already in this lecture, and not seeing egg white does not mean you cannot ovulate. Okay? And polycystic ovaries can cause irregular period because it has a high level of testosterone, which can affect your regular period. Okay? Good. So, somebody asked a question just now. I missed it. Can someone with cystic teratoma get pregnant? Yes. But if you have cystic teratoma, I'm hoping it's been removed. That's why you know what you have. It's been removed. If it's been removed and there's no damage to your tubes, there's no damage to the normal ovarian tissue. Because while we are removing the cystic teratoma, they'll probably remove some normal ovarian tissue. Cystic teratoma is some benign cyst. It's not cancer. It's a benign cyst on the ovary. While we are taking it out, we might have taken the whole ovary out or taken a substantial part of the ovary out. As far as you still have normal ovarian tissue on your other ovary, there's no blocked tubes, you can still get pregnant. Okay? Yes. How to get the PDF? I've already explained that. Just click reply to the welcome email I sent to you that showed you've paid, and I'll forward it and just say, just put one line, PDF. I'll give you the PDF. Don't send a fresh email. If you send a fresh email, I'm going to ask you for payment evidence. You give it to me. And I might even neglect the email. So only click the original email I sent to you. If I didn't send an email to you and I gave you the link for the seminar on my WhatsApp number directly to you, just ask me for the seminar PDF on my WhatsApp number, because I've already given you the seminar link on WhatsApp. That is if I didn't give you email. That's for people that are in the diamond group. People that are in the diamond group or in the gold service group, they will get free access to their email, to their seminar. Some of them, they haven't sent an email. They've only requested for the seminar via the WhatsApp number of mine, which they have, and I've given them the link. So for people like that, just send me a reminder to my WhatsApp number. Okay? Thank you. For referral in Port Harcourt, for referrals now, we don't put it with seminar anymore. I've made it clear when we advertise the seminar that there's no referral for people coming for seminar. So seminar now does not contain referral anymore. Apologies. We discontinued that discount. So if you're attending seminar, it's seminar. If you want a referral, join the premium services. It was a discount before for about 12 months last year to promote the seminar. Okay, so the seminar is not with free referrals anymore. It's totally been disengaged, and we put that clearly on our advert. Can an obsessed person get pregnant without losing weight? Yes, you can get pregnant without losing weight, but if you're overweight, your chances of success is lesser. Okay, yes. Can previous section affect conception? If you had a previous section before, there was complications, there was infection in your womb cavity, it can affect conception because it can cause damage to your womb cavity. But a normal section done without any complication will not affect your chances of getting pregnant in future. Okay? I tried using the Ovulation Kit this month. It showed positive on day 14. Does it mean next month I'll check again on day 14 of cycle? That means that you should check around day 12 to around day 14. Okay? Not on just day 14. Check day 12, check day 14. If you have money, check day 12, 13, and 14. Okay? Like I said again, your chance of pregnancy only on your ovulation day is 30 to 40%. There are still other chances of success outside those days. Okay? That's for Rita Irepono. I have a 28-day cycle, menstruate for 10 days or more. Will your fertile window be on day 10 to 16? Yes. Correct, Uju. Can you refer me to where I can undo cystic teratoma in Lagos? Yes. If you join the premium services, we'll take care of that. But like I said again, Amy Socialese, we do not do free referrals anymore on the seminar page anymore. We don't. I'm sorry. We've changed it. Okay? What causes fluid in the ovary? Sometimes when you ovulate from here, That part of the ovary you release the follicle from can be filled with blood, can be filled with fluid. Okay, it's just natural. Okay, it's just natural. Okay, and sometimes too the fluid will be there, it will disappear again. Some people, they just have fluid for no reason. It gets so big, it becomes ovarian cyst, and then we have to remove it if it's too big and it's causing pain. Yeah, I might have done, because this is before I finish answering a question, and that one is coming up. So I might have missed your question. I'm human, you know. As I'm reading the question, before I answer them, and that one is up. So I will definitely miss question. So if I have not answered your question, put it up again. Let me answer them. I don't have any lab in UK. No, it's in Nigeria. ATG has lab in Nigeria, Lagos only for now, not in UK. We have to do this little by little. We're there at a time, okay? If you've deleted your email mistakenly, go to your email and go to the bin. You will see the email you've trashed in the bin. Go to your bin in your email and go and retrieve it. If you can't retrieve it, then send a new email with your payment evidence. If you've lost your email, okay, you put it in the bin, you can't find it in the bin anymore, then send your payment evidence anew, afresh, okay? Or go to your bin in your email and retrieve the deleted email you've deleted, okay? Did someone that had laparotomy surgery miscarried after? Call the person. If you had a surgery to open your tummy, that's laparotomy. You've had a miscarriage, you can still get pregnant. That's Alalade, wonderful lady. If you've had surgery before, you can still get pregnant, okay? You can still get pregnant, definitely. How can you boost ovulation? There's somebody asked a question about using DQ10 and some vitamins to boost ovulation. They are vitamins. We call them antioxidants. They reduce free radicals that can damage eggs, that can damage ovaries, that can damage production of eggs in the ovary. Now, using those free medications, they reduce damage and they enhance longevity of eggs, longevity of your ovum, longevity of your eggs in your follicle. But they do not make you produce new eggs. No. Okay? So yes, it can enhance your getting pregnant as far as it makes the eggs that are available to live longer, to have less damage, and to be normal. That's okay. But it won't make you produce new eggs. No. It won't make the ovary start producing new eggs. No. No. Okay? Now, somebody asked the question, I had no egg white. Does it mean I'm ovulating? Like I said again, egg white is not necessary prerequisite for ovulating. Because you're not seeing egg white doesn't mean you're not ovulating. If you're not seeing egg white, it doesn't mean you're not ovulating. You can get your ovulation kit in any nearby pharmacy around you. Yes. You did your... I usually have pain on one side of my abdomen. You've done scan, you've done test, nothing is there. It's very painful when period is about to come, affecting your movement. What could be the cause? It could be just an ovarian cyst. And if we haven't seen anything, despite all the tests we've done scan, we've done everything, we can't see anything, then the best thing will be to do what we call laparoscopy. We have to put a camera through your belly button to look into your tummy and to see with a naked eye what could be causing this pain. Is it endometriosis? Is this some ovarian cyst? Is this some what we call congestion of your pelvic vessels? So we do laparoscopy by putting you to sleep, put a camera to your belly button. It's a big operation though, and then we look into your tummy to see any obvious reason why you're having this pain. You're in a 26-day cycle. You have spotting. Sometimes it lasts for 2 days. Could it be ovulation? Yes, true. Because if you're on 26-day cycle, your day 12 is your day of ovulation. Like I said again, during ovulation, you can have some light pinkish spotting. Remember, I said so. During your ovulation, you can have some light pinkish spotting. It's not harmful. No. Dr. Esther, I don't know whether Dr. Esther is ready to come on and take some questions if you're free. If you're free, send me a link. Send me a request. What can you do to boost ovulation? You can take the vitamins, the DQ10, we have DQ10, we have DHEA. They help to reduce DNA damage in eggs. DHEA. Anything that contains DHEA, long name, dihydrotestosterone acetate. Don't worry about that. Just DHEA or CoQ10. CoQ10 is a vitamin B derivative. CoQ10 and DHEA, they enhance and they reduce egg damage. Okay, how can you increase the progesterone level? If you have 3 miscarriages, you're told you have low progesterone, and you're on progesterone injection. So that exactly, you're already on progesterone injection is what you need to boost your progesterone. Only what we need to do is probably to increase your dose or the frequency and monitor you properly, okay? How to get effective sex selection. That's a different seminar. I can't do sex selection discussion on this seminar. It's a different topic entirely, and I can't cover that in this seminar. I'm sorry, okay? We use the app flow. Yes, I know the app flow. I check it as well. We get ovulation right from calculation. We had sex. We haven't gotten pregnant. What can be wrong? What can be wrong is that you should not just focus on the day of ovulation. Focus on your fertile window. And if you're still not able to get pregnant despite having regular intercourse 2 to 3 times a week, whether you're ovulating or not, and you're doing all this sex, regular intercourse, you still can't get pregnant. After doing that for a year, if you're more than 35 years old, then we need to review you, join the premium services link, and I need to check your results properly. If necessary, worst case scenario, refer you to fertility specialist, okay? Best time to get the ovulation result positive. The best time is doing your ovulation. I've explained it, and that'll be on your day of ovulation, okay? The best time to get positive ovulation is on your day of ovulation, as I've explained all the while, okay? Can a 15-year-old child, spacing affect conception? So if your last pregnancy was 15 years ago, as far as you're ovulating, as far as there's no blocked tube, as far as your husband's sperm is okay, you can get pregnant, yes. But if your body has changed, which we don't know, then there could be issues. But waiting for 50 years itself does not affect you from getting pregnant. It's if there are other problems that may have arisen and new while you're waiting for those 15 years that can affect your ovulation. But the 15 years on itself would not affect you getting pregnant, okay? No. Taking lemon juice, pineapple does not affect or disturb or stop you from ovulating or enhance ovulation. No, at all. Taking lemon juice in the morning has nothing to do. So you can take, yes, CoQ10, DHEA. They help to enhance the longevity and strength of eggs. If you want to put it that way. You had 2 fibroids. If you had fibroid surgery 2 months ago, your hormones are not good. You've been diagnosed with ovarian cysts. Can you get pregnant? You can get pregnant, okay? But we need to fix your hormones. We need to know why your hormone level is not normal. So if you've had fibroid surgery 2 months ago, your hormones are not balanced, you've been diagnosed with ovarian cysts, can you get pregnant? Can you be a mom? Yes. Excuse me. Yes, you can be a mom. But I need to know what is wrong with your hormone. Why is it imbalanced, okay? Can I get pregnant with 1 tube? Yes. Blocked? Yes. If 1 tube is damaged, removed, blocked, and the other tube is perfectly working okay, you can still get pregnant. Yes. As far as that tube is okay, your chance of pregnancy only dropped from 100 to 67, not 50. From 100 to 67, not 50, okay? But we must check that as soon as you get pregnant again, we must scan you around 5 to 6 weeks of pregnancy to ensure that the pregnancy is in the womb, not in the tube, okay? Can you get pregnant if you have fibroid? Yes, you can get pregnant if you have fibroid, okay? Are there drugs to increase progesterone for conception? Yes, progesterone injections. Yes, they're in different doses, different formulations, and different idea about it, okay? We can cover that in this later. That is for a doctor to do, but there are injections available, and this progesterone injection, we can give you them to boost your progesterone as we need them, okay? After my myomectomy, my 28-day cycle became between 26 days. Yes. So what you need to do after your fibroid surgery, okay? Pay attention to your body because your period cycle could change. Your cycle could change. So from a 28-day cycle, it could become 24 or 26. It can change to 24, 26. So once you pay attention to your cycle, okay, at least for 2 to 3 months, let your body reset, okay? If you have a 28-day cycle before your operation, after your operation, it could change. It could change to a different pattern. So pay attention to your body, observe your new pattern, and then you can now predict. Give yourself at least 2 to 3 months for that pattern to be established, for the rhythm to be established, okay? Good. Oh, okay, Esther is ready. So, Dr. Esther, I've accepted you. Dr. Esther, it says no answer from you. Okay. Let's see if I turn this camera erect, maybe to accept. Oh, it's not allowing me to turn the camera while I'm talking. Dr. Esther, I've approved your request, but it says no answer from you. Okay, I'll keep talking. Doctor, what can cause large enlarged ovaries, and how can you treat it? What can cause enlarged ovaries? Sometimes ovarian cyst. If it's ovarian cyst and it's less than 4 centimeters, it rarely causes pain. Okay, and in most cases, it will disappear and regress after about 3 to 4 months. If it's from polycystic ovarian syndrome, you have polycystic ovaries, and it's making your ovaries appear big and bulky. You can lose some weight. I'll say maybe around 5 kilos, regular exercise, and if it does not work, we can give you some medications like metformin to treat it. Or if everything fails, we go in with KO camera to destroy those tiny cysts or follicles on your ovaries. Okay? So that is what can cause enlarged ovaries, and how we can treat enlarged ovaries. Okay? Best time to take DHEA every day. Every day. There's no best time, it's every day. Take it every day for at least 3 months to see action, to see clear effect. Every day. Okay? Good. My period, I'm 41-year-old. My period has been irregular since March. What's my chance of success in pregnancy? First of all, your chances is good. But to know exactly if you have a good chance, we need to check your hormone profile. We need, and that will include your LH, FSH, day 21, progesterone, prolactin, testosterone. Okay, and check your tubes by doing HSG to see if it's blocked or not, and also by checking your husband. Once we know all this, we'll be able to detect and know exactly your chances. Is ovulation essential for IVF? No. For IVF, in most cases, we take over your ovulation with medications. Okay? So, ovulation is not essential for IVF. Like I said again, ovulation is essential for natural pregnancy. But for IVF, ovulation is not essential because we take over. Okay? Sometimes we only give medication to make your womb ready, and we go and transfer and implant egg. So ovulation is not essentially necessary for IVF to be successful. But for natural pregnancy, ovulation is paramount. What is DHEA? It's some vitamins that enhance the longevity of eggs. Okay? Can ectopic pregnancy be corrected without surgery? Yes. We can give some medications like methotrexate to shrink ectopic pregnancy. Methotrexate is an injection we give to women that have ectopic pregnancy, that there's no heartbeat in ectopic pregnancy, they're not bleeding, they are stable, they're not fainting, they're not collapsing, and we know that they will keep to instruction, that they'll come to hospital for monitoring. So we give them the injection, methotrexate, to shrink the ectopic pregnancy, and we monitor their pregnancy hormone level for at least a week to 2 weeks, sometimes up to 6 weeks, to ensure that the pregnancy is disappeared. Okay, DHEA is a vitamin that helps longevity of the egg. What causes watery flow after sex is normal. After sex, okay, the husband has poured a high level of akamu, pap, inside the vagina. After a while, water will seep out. It's normal. It's totally normal. And there's nothing wrong in some semen seeping out after sex. It's normal law of gravity. Sperm that is good, that is perfectly okay, will swim into the womb easily. Okay? How does low hemoglobin affect consumption? So if you have low hemoglobin, okay, that is critically low, that means either you're sick, you're bleeding, or you're not well. And in most cases, if you're not well, the body will not get you pregnant. The body will say, you're not well, oh, don't get pregnant. So if you have low hemoglobin from sickness, from renal problems, from other medical problems, your body will shut down to focus on you being healthy and surviving than getting pregnant. How do you know if your tube is blocked? We do HSG to check whether the tubes are blocked or not. We do HSG to know if your tubes are blocked or not. Is some vitamin. Okay, yes. How do you know tube is blocked? By doing HSG. A woman of 46 years old not seeing her period regularly, can she be ovulating? Very unlikely. If you're 46 years old, you're not having regular period, you're probably not ovulating. But that's just a probability. To know that for sure, we have to do hormone profile test for you. We have to do HSG, check your husband's sperm count to know whether you have any problems that we can correct, okay? If you've answered your question, don't put it again. So be respectful and let other people ask their question. If you ask the question, you've been answered, let people ask question. Folic acid, prenatal care, vitamin D, vitamin E, they are okay. But if you're trying to get pregnant, I'll suggest you leave vitamin E out of it. If you're trying to get pregnant, just please leave vitamin E out of it. Focus on your 10 milligram of vitamin D, 10 microgram of vitamin D, your prenatal care, your folic acid, and they are okay if you're trying to get pregnant. Vitamin E, leave it out. Aside from fertile window around ovulation, what other windows? There's no other window. There's no other window. This house has only got one window. This house has only got one window. There's no other window, no. It's only fertile window, we know. There's no sex window. Every day is sex. Every day is boss, okay? Every day is action. Everyday action. Is it true that some egg falls into the abdomen, not the tube? Yeah, if your egg falls into the abdomen, the body is designed that the tube will go and look for it and pick it up. That's all I know. Because if you've watched an ultrasound scan done under electron microscope, once the egg is released, even from left or right ovary, the nearest tube will go in and pick it up. I've seen eggs released from the left ovary and they know that, oh, this left tube is blocked. The egg will move to the right tube to get inside the womb. The body is designed that way to function. That is God in the body. Okay. If you have a damage or blocked right tube and your left ovary releases egg, okay, it will find a way to that tube that is okay and enter. Okay, that's the way the body works. If you've seen it before, you appreciate God, that God is there. If you're lactating, can ovulation vitamin help you get pregnant? If you're lactating, ovulation vitamins, there's nothing called ovulation vitamins. There's nothing called ovulation vitamin. Nothing. There's nothing called ovulation vitamin. Again, I'm repeating again, there is nothing called ovulation vitamin. There is nothing called ovulation vitamin. Let it move into your mind and your subconscious. There's nothing called ovulation vitamin. Okay? Some vitamins help to give the eggs power to be durable, last longer, but they don't make you ovulate. Okay? Good. Can pregnant care provide all necessary vitamins during pre and pregnancy? It can, but never neglect the effect of balanced diet. Okay? Good. Dr. Esther, I've seen your request. I've approved it to join. But I think because my phone is on the landscape, it's not allowing me to accept you. And I try to flip it to the to portrait stand. Is saying that I cannot change the Is saying that I cannot change the phone to portrait while starting the seminar in landscape. So that's why I'm having a problem to accept you, Dr. Esther. Dr. Esther, I know you're trying to come in. I've accepted it, but it's saying that there's no reply. There's no reply from you, and I think it's not you. It's just because that I've started the seminar in landscape mode. It's not allowing me to flip the phone to portrait while talking. It's saying that I can't change the phone position while on live show. Apologies for that. So, Dr. Esther, you can help me answer questions in the background, please. Thank you so much. Is there any drug that can boost egg quality? Yes and no. Like I said again, those antioxidants, they can boost egg quality. Overcare, DHEA, Q10, yes they can, but they don't make you ovulate. They don't increase the number of your eggs. They only protect and prolong the quality of the eggs that you have. Overcare, DHEA. Please get what I'm saying and don't interchange my advice. I've been diagnosed with ovarian cyst, endometriosis in the ovary, and I do experience brown discharge. Can I ovulate? Yes. Yes. As far as your day 21 says you're ovulating, but if your endometriosis has damaged your tube, if your ovarian cyst has damaged your tube, even if you ovulate, it's probably not going to find its way into your womb. So you can ovulate, but if there's damage in the tubes, it won't get there. That is why if you're ovulating, all your numbers are right, but there's a damage or blockage in your tube, you're still not going to get that egg to enter into the womb. If you are ready to enter the bus and you've entered the bus to go to Oshodi from Lagos Island, and there's traffic on the way, there's blocked tube, traffic on Third Mainland, you're not going to get to Lagos to Oshodi. You are blocked. Okay? So even the bus is working well, the passengers are there, but the traffic road, the road is blocked. You're not going to get there. So if the tube is blocked, even if you're ovulating, you can't get pregnant. So having endometriosis, having ovarian cysts does not stop you from getting pregnant. Doctor, what causes pain during sex? Infection, trauma, candidiasis, can cause, or poor lubrication can cause pain during sex. You say vitamin D, folic acid, prenatal vitamin should be taken only. No, I'm not saying that. I'm saying that you should take vitamin E, you should take folic acid, take pregnant care, okay? While trying to get pregnant. But don't neglect the purpose and the place of balanced diet, okay? If you have, so that is that for Jennifer. Jennifer, I've answered your question already, okay? After HSG, you've not seen your period, and the results showed your tube are not blocked. I say it again. After HSG, your period could be slightly irregular. It's normal. It can happen. Give yourself up to 2 months, or in most cases a month, but 2 months for your body to reset, okay? No panic at all. GTC means getting to conceive, okay? My cycle is sometimes 29 days, 26, 27. How do you know your cycle length, okay? For this case, it's difficult, okay? But I'll suggest you take the shortest and the longest. So for you, it's 26 and 29. That's about 3 days. So take the middle, 28 days, and use that to calculate your fertile window, okay? Very good. Okay? Are there any drugs to increase prolactin level? No. We only have drugs to decrease prolactin level. Prolactin level that is normal or slightly low is okay for you to get pregnant. If your prolactin is too high, it damages you and make you not to ovulate. So, but we don't have medication for low prolactin. All right? Good. Can you talk about stopping family planning? No. Family planning, I can't take it on here. It's a big topic on its own. So it's going to be a long discussion. But I'll just focus on your question. That question is for Oluwakemi Oyindamola Ayola Atayishi. Can you talk about stopping for family planning and trying to get pregnant again? I'm having a irregular period. How long does it take to get pregnant again? I used implant for 3 years and Depo. Now, Depo injection as contraception can linger in the body for up to 12 months. So if you add Depo injection, allow your body at least 6 to 12 months for the injection to wear off, okay? So after 12 months, if you're not able to get pregnant, they will need to start doing workup on you. All right? That's for Kemi Oyindamola Aitayeshi. Amaka Iyejiofo Inziak, I'm sorry. Amaka, put your question up now. Let me see your question, okay? My follicle doesn't rupture. What can be done? That's what we call luteinized or ruptured follicle syndrome. You need to be referred to a specialist so we can see you and start giving you treatment to see. But in some cases, despite treatment, it doesn't work. But let us know that for sure. Do your full hormone profile, and then I'll get you to see one of our fertility experts. What medication for hypolactin? We have many of them, okay? Dostinex, and so on and so forth, Cavagoline. But it must be given to you with a specialist advice because you need to be monitored while on it. If you take it without control, you're going to mess you up. So you need to be under watchful eyes and target monitoring to ensure that you are well checked out. Please, doctor, what drug can someone use to boost the immune system? Balanced diet, your vitamins, regular exercise, taking 3 liters of clear water over every 24 hours every day to boost your immune system and being not overweight. How long does it take? How long does it take To get pregnant after laparotomy surgery and miscarriage, give yourself 2 to 3 months if everything is fine and there's no complications, okay? Olarewaju, you've asked about 3 questions now. Can you let other people ask other questions too? Let people ask questions too. Please, let's be considerate. Thank you, okay? Does Yasmin oral pills have effect on ability to ovulate? No. Yasmin oral contraceptive does not have an effect. It stops you from ovulating while you're on it. As soon as you stop the Yasmin, within 2-3 months, you're back to ovulating. So Yasmin stops you from ovulating while you're on it. Yasmin should be desogestrel. It stops you from ovulating while you're on it. As soon as you stop Yasmin, you ovulate. But Yasmin also increases the risk of your blood clotting. So if you have family risk of blood clotting in your family with pulmonary embolism that can cause death, avoid Yasmin. If you're a smoker, avoid Yasmin. Yasmin can increase the risk of blood clotting, which can be damaging to the body. So if you got a family history of blood clotting in your family, don't go near Yasmin, okay? Thank you. Thank you, Dr. Esther. I'll suggest if you want to use the best kit for ovulation, use Clear Blue. Use Clear Blue for tracking ovulation. Use the Clear Blue. Use the Clear Blue, okay? Clear Blue is almost 98-96% very, very predictive of success. Almost 99%, in fact, predictive of success, okay? So use your Clear Blue. How can one not menstruating know she's ovulating? If you're not menstruating, you're not having regular period, that means that you're likely not to be ovulating. For such case, we need to know why you're not menstruating. We need to do your hormonal test to see why exactly you're not ovulating, okay? Thank you, Dr. Esther. Thank you for doing some phone massaging there. Nat is asking, what do you advise to do to get pregnant? Endometriosis and ovarian cysts affected one tube. Yes, so we move the endometriosis, we remove the ovarian cyst, then we check to see whether your both tubes are not blocked. If they are not blocked, good. If they are blocked, one of them is blocked, okay. As far as the other one is blocked, okay. If both are blocked, IVF. While doing that, we check your ovaries to ensure that you're ovulating. If you're not ovulating, that's another problem. We also check your husband's sperm too. But don't forget that there's a sperm that needs to get you pregnant. So apart from checking you, we should always check your husband's sperm too. What are the chances of getting pregnant through IUI or IVF with one tube blocked? Very good chance. As far as you're ovulating, you're producing good eggs, your husband's sperm is good, chances of getting pregnant with one tube blocked with IVF is very, very good. Somebody says he sent me a picture of a hormonal profile. Is it to my email? Remember, we don't this is seminar. You can't send your test result. To send test result, for me to look at your test result, there must be a consent and agreement with you, with me and you. And the seminar doesn't cover that. For that consent and agreement for me to look at your result, it's through the premium services. Because for me to look at your result, okay, there must be an agreement that you agree that I can look at it, which must be documented. That is covered in the premium services. It's not covered here. So if you send me any results to the email, that is not the right thing. And unlike, I will not probably look at it, okay, because there's no agreement there. Yeah, all these things are binding in some way. Okay. For Rachel Obidalo, we'll put up the link for the lab address shortly, okay? Just stay focused. We're going to get it now. I've used all the science Dr. J listed around ovulation, including seeing egg whites. That's what I know of. That's why I know I ovulate. But worried as to why my cycle is irregular, even 10 to 12 months. So we need to refer you for IVF for the review then, or to repeat all your hormone profile tests to see what is going on with you. Yes. So if you've done everything I've said here and it's not happening, then we need to do tests on you to know exactly what's going on. Because that means that we cannot, obviously we need to look for the obvious reason. And the obvious reason will come from simple lab test, okay? I'm trying to answer questions here as much as I can. Everything's coming fast. I'm human, you know. Before I finish talking, there's 3 or more waiting, and it's moving on the screen. I can't check everything. So I'm trying to check all quickly. So listen to the answer to your question. And if you've already asked a question, let other people ask their own questions too. It's not only you now. Okay, good. I said again, to check for ovulation kit, check on the day of your ovulation or check a day before your ovulation. So if you've done your calendar, you know that you're going to ovulate around day 14, use your ovulation kit on day 13 to check for prediction, to know whether you're ovulating. You can use your ovulation kit on day 13, okay? So on day 14 as well, if you can. I already answered that question, okay? That's for Princess NK Agege, okay? Chinwe Blessing, what's your question? I'm sorry, I missed it. I'm so sorry. Apologies for that. What's your question? Bleeding from belly. Why menstruating? Yeah. So Agugwa Ilari, I think I saw your question prior to the seminar, that you're bleeding on your belly while you're menstruating after fibroid surgery. What it means is that you have endometriosis, what we call scar ectopic. Scar ectopic. Sorry, scar endometriosis. Sorry, apologies. You have scar endometriosis. Scar endometriosis. If you're bleeding from your belly during your period, after a fibroid surgery, or after a C-section, you have what we call scar endometriosis. And what is endometriosis? It's when the lining of your womb that normally bleeds out during your period, for some reason, they find their way out of your womb and go, not all of them, or some of them, and implant on your ovary, on your tube, or your bowel, and sometimes during surgery, which is very, very rare. During fibroid surgery, during or any other surgery on your tummy, they get moved or transposed, maybe from their implantation on the ovary, implanted on your scar tissue, or they move there for any reason I don't know. They can implant there and they swell and they bleed during your period the way their brother and cousin bleed in your vagina. They swell there and after your period they shrink back. That is scar endometriosis. What we need to do is to open you up and remove that scar tissue there and it's gone. Case closed. It is scar endometriosis. Scar endometriosis. Okay? Scar endometriosis. Open you up, remove it, case closed. I was sent. Okay, let's look for questions. Thank you, Dr. Esther. Thank you, Gloria. I can see your handiwork there. Doctor, I saw my first menses after childbirth on the 1st of last month. I'm seeing it today. What is the cause? So 1st of last month is what? 1st of August. So you haven't seen your period for about 7 to 8 weeks. And you had your baby, 1st of last month. Sorry, baby 1st of last month. And you see your period for the first time about 7, 8 weeks down the line. Today is normal. Remember I told you, after a normal delivery, after a C-section, after a fibroid operation, your period will be at least going to change. It can change. Your pattern you're having before this operation, this procedure, is going to be probably different from what you used to. Okay? And number 2, it could be slightly heavier than expected, slightly heavier than what you're used to. Number 3, it could be 2 to 3 months before it settles down to its usual rhythm. So seeing your period 7 to 8 weeks after a delivery is okay. It's perfectly okay. If you have problem tracking your period, despite all this explanation today, I think you need to do a hormone profile to know exactly what is wrong. Okay? Thank you. The normal range for LH, FSH, prolactin, estradiol. I think some of you want to go to medical school while you're on this program. Okay? Okay. Now, LH is usually from about 3 to 8. The same thing with FSH. Prolactin usually less than 15. Okay? Some cases about 25, depending on the unit you are using. Because these test kits come with different reference ranges. It all depends. So if your prolactin is more than 25, it's probably high, regardless of the range. Okay? Thank you. What causes excessive watery discharge up to 5 days around ovulation? Can it cause infertility? No. Excessive watery discharge, as far as it's not offensive, it's not itchy, it's not smelly, it does not affect ovulation. It does not cause infertility. It's normal. Okay? Good. If you're worried, get vaginal swabs done to check for infertility. And if there's any infertility, you get treated. Okay? Very good. What causes somebody to have boy or girl? Is God. What causes somebody to have boy or girl? It is God. It is God. What will make a person have a boy or a girl? It is God. Oh. It is God. Okay? But if you want to do gender selection, then you have to include IVF in your program. Gender selection is about 5 million naira. That is what I know. Okay, that they have to do some tests to know which egg is the boy, which sperm is the boy or girl before they get you fertilized, or shortly after fertilization. But what will cause you to have a boy or girl? What will cause you to have a boy or girl is God. Okay. What is done to treat unruptured luteinized follicle? Well, what happens to the other mature follicle between 8 and 20 apart from dominant follicle? So for unruptured luteinized follicle, we can do surgery, we can give medications, we can go for IVF. What happens to the other mature follicle? They regress, they shrink, and they disappear. You've had 2 miscarriages. My daughter is 2 years old already. Doctor, maybe because I didn't do evacuation for the time and it causes second. No, because you didn't do. There are many ways we undo. There are many ways we undo miscarriage. Sometimes we let it disappear on its own naturally. We call it conservative management. Sometimes we do undo evacuation, surgical management. Sometimes we give medications to help you to pass the pregnancy out, which is medical management. Okay, if you've chosen any of the management, it will not cause miscarriage in your next pregnancy. Okay, no. So because you didn't have evacuation, that's not the reason why you had miscarriage. You said you're on danazol. Okay, you're on danazol. I don't know why. Probably for polycystic ovarian syndrome. I don't know why you're on danazol, but it's probably for polycystic ovarian syndrome or for hair on your skin. That's for a different reason entirely. But that will not cause not having evacuation will not cause you to have miscarriage. That is for Ademoyegun Marcus. How can one cure premature ovarian polycystic ovarian syndrome, hormonal imbalance? So for that, we first of all do basic hormonal profile test. We see and we try to know which hormone is imbalanced. Once we know the hormone that is imbalanced, we'll fix that. That is just the honest truth. You need to lose weight as well if you're overweight. You need to check you for diabetes if you have diabetes and treat your diabetes and get you fixed. Can scar endometriosis make you not get pregnant? Very unlikely. But it will cause you pain, discomfort, okay, and then we have to treat it. Can a D2C woman take green tea? Yes and no. Green tea does no harm, okay? But some of these teas that you're buying, I don't know how it was prepared. So I suggest if you're not sure of how that tea was prepared, or maybe ask any other thing extra apart from green tea, I'll say hands off. But if you're sure that it's just green tea alone, it does not do any harm to a GTC, to a woman trying to get pregnant, okay? Let me go and get a cup of water here, okay? Give me a second. Yes. Very good. I hope you can still hear me. My period stop. Yeah. Chlomid can cause period to stop. Chlomid can cause period to stop. Estradiol 58, progesterone 14, perfectly normal. Estradiol 58, progesterone 14, normal. How does a woman know she's ovulating when she's not menstruating? If you're not having period, you're not menstruating, then you have to do your day 21 progesterone. If you can't do your can't do your progesterone because we don't know your day 21, then we have to just do your hormone profile any day. Because you're not menstruating, we can't count your day 21. We can't count it because you're not menstruating. We just have to do your hormone profile and do everything as soon as we see you and know exactly what's going on. From there, we can start to think of what to do. Okay, if you're not menstruating, we just have to do your hormone profile straight away. Okay, or we can give you medications to make you bleed. Okay, and we'll start counting your day 21 from that bleed, and then we'll do your progesterone test and we'll do your other hormonal profile test. Okay, Doctor, my gynecologist placed me on Alalade tablets. Has any effect? Alalade was given to you before high prolactin. So your doctor needs to check you 4 weeks after you've been on Alalade to see if your prolactin is coming down. And if prolactin is coming down, good. If it's not coming down, then it might need to increase the dose, change the medication, or put you on combined medications, okay? Doctor, how can I see my period? Doctor, what can I do? My period is not flowing. For example, first day of cycle, I use 4 pad, but now I use 1 pad a day. First of all, we do your womb profile. We do ultrasound scan. We do hysteroscopy to check your womb cavity to see what's going on. Is there anything that has been done to your womb, maybe operation in the past, that has caused narrowing or blockage of your cervical canal? Okay. Is it okay to take vitamin E for GTC? Leave vitamin E alone. Again, leave vitamin E alone if you're trying to get pregnant. Case closed. That's for Olajuwon Oyin testimony. Lydia Erika, can someone with 15 centimeter fibroid ovulate? Fibroid has nothing to do with the ovulation. Fibroid has nothing to do with the ovulation. But obviously, it can cause pain, increase your bleeding during your period, and in such cases, you need to remove fibroid of 15 centimeter. 15 centimeter fibroid is as big as a football. It's as big as my head. So if you have a fibroid in your tummy as big as 15 centimeter, you gotta get it out. It needs to come out. But it's not having any effect on your ovulation. Okay? And the fibroids as big as that, they will definitely compress on your tube. And that will make you to have problem with infertility. Okay? So first advice, get that fibroid out of that place. God bless you. Thank you, Dr. Esther. You always menstruate in clots. That's for Immaculata Chinonye. You always menstruate in clots. Does it affect ovulation? If you're menstruating in clots, it's either that your womb lining is thick and you might have polycystic ovarian syndrome. Okay? For such cases, I'll suggest first thing first is for you to have hysteroscopy. We put a camera through your womb, to your vagina to look into your womb cavity. We look at your womb cavity. See what is causing this dark bleeding, this clot bleeding. Okay? Take out or take any biopsy we can to test the womb cavity. Take biopsy. Okay? We take it from there. Again, Valencia Ngozi Agunobi, I've already answered your question. Estradiol level of 58 and prolactin of 14 is normal. Ngozi Valentina, if estradiol 58, progesterone 14 is normal. It's okay. Off the mic. Now, January to May, you didn't see your period, but June, it started coming out. What could be the cause? Hormonal imbalance. You check your FSH, LH, prolactin, testosterone, progesterone, and we see what's going on. And we do a scan as well. Okay? We'll find out something. Does alkaline coffee affect ovulation? I have no idea, to be honest with you, what is alkaline coffee. Okay? But if you're trying to get pregnant, leave coffee out of the show. You're trying to get pregnant, leave coffee out of the show. You want to get the gender selection PDF, follow the link on our Facebook link to get every PDF we've had, and you get your selection, or send an email and ask me for the link to get a gender selection PDF, and I'll send the link to you to get the PDF as soon as possible. Okay, good. What do I do to my body that feels hot when I touch the back of my palm? Your body is feeling hot. It's either you're ovulating now. Like I said again, during ovulation, your body will be warmer than expected. So it's likely you're ovulating, and that's normal. As far as you don't have fever, you don't have temperature, you don't have fever, you are okay. But if that increase in temperature in your body is a sign that you're ovulating. I hope the mic, yes now. God bless you. Guys, I'm exhausted now. Progesterone 2.5 is too low, okay? Progesterone 2.5 is too low. Somebody's asking, how do I calculate ovulation? I've gone through the ovulation calculation slowly during the seminar. So watch the seminar over again. Watch the seminar over again, please. But if your period is not regular, okay, you have a 25 to 29 day cycle variation, go for average. 29, 26 day variation, average will bring you to around 27 days. Choose 27 days Use it to calculate your ovulation. That's number one. Once you've done that, get your fertile window. For you that is a bit irregular, have sex every other day. Every other day. Every other day. Whether you're ovulating or not, have sex every other day. The only time you should not have sex is during your period. If you're still not happy with that, then we need to do all your hormone profile to know what is imbalanced. That is for Agege, Jessica, Lawrence. This is for you. We do your hormone profile, okay? But I suggest first of all, use the average of your question here, which is 27 days, to calculate your fertile window, okay? Chinwe Blessing. Now I will stop now. I want to see your question. I want to see your question before I stop. So, Chinwe Blessing, put your question up now. I'm waiting. I'm going to do nothing until I answer your question now. So, I'm waiting. So, Chinwe, okay. For painful HSG, take pain medications, paracetamol, codeine, Buscopan, an hour to 2 hours before your HSG. Valentina Ngozi, I've answered your question. I don't like it. Let other people ask questions too now. LH, FSH is normal. Your FSH 4.5, 7.5 is normal. Okay, it's normal. Okay? Your LH of 4.5, FSH 7.5 is normal. That's Valentina Ngozi. Please, let's stop there. Let me take question from other people too. I need to take question from Chinwe Blessing. Chinwe Blessing, I need your question so I can answer you. Chinwe Blessing, where are you? Inziako Amaka, I've answered your question already too. Amaka EGF4, I've answered your question. Primrose does not boost ovulation. Primrose, that's for Uju Chambers. Primrose does not boost ovulation. For hormonal imbalance test, you go to lab, they take your blood test on specific days during your menstrual cycle to do your hormonal imbalance. They put the blood test in the machine, and we get results. So we do hormonal imbalance test on specific days of your cycle. We tell you all that during the lab anyway. For lubricant, get pre-seed. Chinwe Blessing, where are you? I need your question now. In Amaka Eziako, I've answered your question already. I'm not going to answer it again. I've answered it twice. Amaka Ejafo. So for Oluchi, your doctor in America told you to take pregnant care vitamin. Go ahead and take it. Oluchi, America, doctor there told you to take vitamin for conception, pregnant care. Go ahead and take it. Is it possible to ovulate during period? Yes, but very unlikely. Is it possible to ovulate during period? Yes. We don't say anything. We don't say never in medicine, but very unlikely. Can I ovulate? That's for Lady Rocks, Mickey. Can I ovulate while using family planning to get to? Can I ovulate while using family planning? Very unlikely. Can you ovulate while using family planning? Very unlikely, but possible, but very unlikely. Ibe Onyinye, how long must someone with low progesterone and estrogen continue to upgrade hormones to induce period? So if you're using medication to augment your low hormones, you need to be under a care of somebody, tracking the results, tracking whether you are responding to the medication, so that you don't keep doing the wrong thing forever. How long? 6 months is enough to monitor you. Okay, good. You have low prolactin. What should you do? Nothing for you to do. Rachel Obidalo, nothing to do. Stephanie Iberi, what causes pain on nerve during menstruation? Secondly, after day 5 of menstruation, you spot till day 9. What could be the cause? It could be caused by infection. It could be caused by maybe thrush infection. It could be caused by hormonal imbalance. Nerve pain during menstruation is probably because of your high level of progesterone, okay? What causes cramps? This is for Mary Claret. What causes cramps that flows to the leg days before period? It's probably compression on your nerves. Maybe you have an ovarian cyst or fibroid compressing your nerves, okay? Is it possible to ovulate during period? Once again, Alice, Adeyemi, I've answered your question. You can ovulate during period, but it's very unlikely. Drames, you are anemic and you have goiter. You take a lot of iron. Does it affect getting pregnant? If you have goiter, it will affect your hormonal imbalance and it can affect you from getting pregnant. So if you have goiter, it must be treated, whether with medication or with surgery, with medication or with any treatment plan. Because if you have imbalanced thyroid hormone, it can affect you from getting pregnant. You can't get you some. You're calling me Zaddy. God bless you. You're my daughter too. This guy's cracking me up. Now, Primos might help with menstrual pain, but there's no guarantee. But it might help with menstrual pain. Can one get pregnant immediately after HSG? Yes, I've seen people get pregnant. They've been trying to get pregnant all their life. They went for HSG. Maybe a slight thing blocking their tube was even cleared out during the HSG. And I've seen people after HSG, they got pregnant the following month. Yes, but HSG is not to make you get pregnant. HSG's purpose is to check if the tube are blocked or not. It's not intended to get you pregnant, okay? HSG is to check if the tubes are blocked or not. But I've seen people get pregnant shortly after they finished HSG. Your womb is still big after you've had a stillbirth. First of all, go and get a scan done. When you get a scan done, we check your womb to see why is it still big. Is there anything left behind that needs to be resolved? So get a scan. Okay, guys, now we've been here for 2 hours. I need to start rounding up now. I'll have to share a word of prayer, and we close the seminar for today. Thank you, everyone, for being here and for attending the seminar. I really appreciate you. And once more, thank you for making today a wonderful day. I'll say a prayer. I'll leave the seminar to be running so that Dr. Esther can still answer some leftover questions that I might have missed, okay? First of all, let us pray. So like I said again, to get a seminar PDF, just click the reply I sent to you when you sent in your payment evidence. Click reply to that email and just put one line, PDF. That's all. Within 7 days, before next week Saturday, again, before next week Saturday, I'll send you a reply and I'll send you the link to watch and the link to get this PDF discussion of all this seminar. And in that PDF, there'll be a link for you to click to download the video and watch the video of this entire seminar. That's number one. If you don't click the link I sent to you, I will ignore your email. Most cases, I will ignore the email. Or if I have time, I will ask you to send the payment evidence to ensure you've paid. The reason why I'm telling you to send a reply to the email I sent to you is that by doing that, it will let me know that indeed you've paid. If you join the seminar through a diamond link by sending me a request on the WhatsApp number that you're using to chat me, on that WhatsApp link, just ask me for seminar PDF by next week's Saturday, and I'll give it to you. If you've paid for the seminar, click on the email I sent to you as a reply, click reply, and I'll send the link to download the seminar PDF to you. If you don't follow the instruction I'm giving now, I will not answer you. If I don't answer you, it's not my problem. It's because you're not following. If you've deleted the email, go and get the email from your bin in your email. Or if you can't find it anymore, just send your payment evidence all over again, and then I will answer you. Okay, Dr. Esther, don't worry. What I'll do is that once I finish now, I'll close the video and then I'll send you an admin link so you can come up and you can do another video to answer questions. So I'll quickly pray a prayer. Dr. Esther will come up live again, okay? Thank you, Dr. Esther. God bless you. That's very, very kind of you. Thank you, mighty God, for today, for being making another wonderful one. We've tried as much as possible best to do justice and make things better. I pray by God's grace, these things we've shared will be used in a positive way to enhance joy and life in families. We pray, we ask, and we pray for this by your grace and mercy. Amen. So thank you, everyone. So I'll close this video now. Dr. Esther will come up live, and then she will start answering questions as well. Thank you, everyone. God bless you. I'll have a wonderful day. Bye-bye.